because it contains a lot of subcutaneous fat, the insulin is injected on the subcutaneous fat. So you should always tell your patient to inject the insulin. You have to keep 2 fingers away from the navel on both the side, and all the area of the abdomen can be used to inject the insulin. The second best option is the outer surface of the thigh. The outer surface of the thigh, again the rotation will happen. Maybe you can go from downwards to above or above to downwards. The rotation can happen here. The third best area is the upper back here and the buttocks, which can be again rotated same ways as I explained about the abdomen. And the last part is the upper part of the arms. Why is rotation important in a patient? Because this can cause lipodystrophy, that is the abnormal distribution of the fat. So lipodystrophy can be of 2 types. It can be lipohypertrophy, that means you will see some swelling around the area where the patient is injecting again and again, or lipoatrophy, that means you can see some absence of the fat from certain area. Both these area can cause some variation in the insulin absorption. That's why the patient should always be instructed to rotate the site whenever they inject. When using a syringe, you should always make sure the patient uses the correct color code of the syringe. So when using a pen, you should dial the desired amount of insulin, say 20 in this case. Now you have the site ready, you just have to pinch it. So pinching requires just have to use your 3 fingers and pinch slightly. You don't have to dig deep and get the muscle out. You just want some subcutaneous tissue, so you can inject the insulin. Just pinch it slightly and make sure that the injection and the pen goes straight away into 90 degree. Many of your patients are on premixed insulin or NPH or a different combination. So whenever the patient is on a premixed insulin or a NPH insulin, make sure you tell your patient to properly mix the insulin. So if the patient is using a vial or a syringe, vial with a syringe or a pen, the mixing has to happen properly. So whenever it is vial, you have to just tell the patient to roll the wire in between their palms and just rub it for 10 to 15 times. So this is much more easier for the patient. Make sure the patient do not shake the insulin. So because the shaking of the insulin will reduce the potency of the insulin. So whenever a patient is injecting insulin with a syringe, you should make sure the patient uses the correct color code of the syringe. So red color code is used for 40 international unit vial, and orange color is used for 100 international unit vial. So here you have to tell your patient, so by suppose we tell our patient to inject 20 units of insulin, the patient should retract the plunger to 20 and push the air inside this syringe. For that you have to first clean it with swab and inject 20 amount of air to make the pressure stable, and then you have to just pull the plunger to come towards 20. So there are some air bubbles, so make sure that there is no air bubble. So just prime it so there is no air bubble. Now this injection is ready to be inserted. So when using a pen, you should dial the desired amount of insulin, say 20 in this case. Now you have the site ready, you just have to pinch it. So pinching requires just have to use your 3 fingers and pinch slightly. You don't have to dig deep and get the muscle out. You just want some subcutaneous tissue, so you can inject the insulin. Just pinch it slightly and make sure that the injection and the pen goes straight away into 90 degree.